Dr. Kapur, you have to unmute yourself, please. You don't mind? Good morning, Mohan Bhai. Just waiting for Dr. Kapur. Are you there? Yeah, I can see. Good morning, Mohan Bhai and Kusala ji. Nice to hear.
Good birthday.
Good time.
Yes,
Sandeep.
thank you. I went to pottery class, did a lot of pottery and all that.
Okay. Great,
Good,
great.
good.
Dr. Kapur, unmute yourself, please. That's it. You're ready. Unmute. You can start whenever you're ready now. Thank you.
Okay, lovely. Namaskar, everybody.
Namaste, Dr. Kapur ji. Namaste ji.
Namaste.
Namaste.
Namaste, namaste, namaste.
Good morning.
Jai Mata Di.
Good morning, Suprabhat. अमृत बेला नहीं है ये, अमृत बेला नहीं है, खत्म हो गई अमृत बेला. ब्रह्म मुहूर्त खत्म हो चुका है. Okay, lovely. I hope that ladies here who requested this topic. Yes, are you there, Maria?
Yes, I am here.
Thank you. Thank you. Okay, then carry on. Okay, let's sit straight. Take a long deep breath from the nostril, chanting the word Om from the mouth 3 times. Om. 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 Om Bhurbhuva Swaha Tassaviturvareniyam Bhargo Devasya Dhimai Dhiyo Yonam Prachodayat. Om Sarve Bhavantu Sukhina Sarve Santu Niramaya Sarve Bhadrani Pasyantu Ma Kashchit Dukh Bhag Bhave. Om Shanti Shanti Shanti. आइए बड़ी श्रद्धा विश्वास के साथ with a full devotion and surrender we are going to start our session of yoga. Again, keep in mind all the precautions, whatever you are doing, whether you are doing your physical exercises, pranayam or asana poses. Follow your own body, don't overdo it. If you have hypertensive, heart problems, severe acidity, severe asthma, severe backache, do it very, very slowly. Same goes when we are doing the exercises. Don't bend forward if you are suffering from hypertension, low blood pressure, osteopenia, osteoporosis, heart problem. And when you're going back, don't go back if you've got hernia, simple hernia, big size hernia, or you're having acid reflux or hiatus hernia. So keep in mind all these precautions, because every day we feel different, especially if you're recovering from any ailment. You have to do everything very, very at slow pace. But again, you know, There are three ways we are doing about, depending upon the strength we are using. The slow, medium, and the fast. But on the Zoom, I request everyone not to do fast. Though I know some of you are quite fit to do fast even. But I think it's good idea not to do. If you are doing in the classes face-to-face, that is different. You can keep an eye on everyone. So my friends, let's start now. First, we will do some poses to activate ourselves and make our body active. Today, your topic is sinusitis, which is such a common problem. Okay, let's start with our exercises. Moving your fingers. Then you can do like this also, whatever suits you. And here you are doing your Bhadrika Pranayama. Breathing in and out from the nostril, mouth is closed. Deep breath in. Deep breath in. At your own pace. The beginners are doing 2.5 seconds in and out. When we are doing practice for a long time, we can increase up to 5 seconds, 7 seconds. Go on doing this, activating all our joints of the hand, the wrist, the elbow, and the shoulder even. Good for rheumatoid arthritis. Pins and needles. ऐसे लगते जैसे कीड़ियां चल रही हैं हमारे हाथों में. And while doing like this, you are increasing your grip pulse. Grip. We can hold better, otherwise we are throwing the things. Make a fist. Again, we have to do many times. Here we do only sort of demonstration. But at home, depending upon your problems, do that particular asana, pranayama, and physical exercise. Spend more time on that, what your disease requires. Then open up wide. Stretch your fingers. Stretch. Stretch. The movement. Dancing. We are all dancing. Shamanji had birthday yesterday, so we are dancing today. Yes, we are all dancing. Happy birthday to you, Shamanji. Happy birthday to you. Happy birthday to you. Yes, do quite a lot. Can do like this now. We are dancing. In this, see how many parts of body is getting activated. Your neck, your shoulder, your arm, full arm, and your chest also. Good for your heart and lungs. One simple movement. See? Simple movement. Neck movement also. If there's any pain in the neck, please don't move it. Rest. That is the first thing. Rest first. Then move. We are moving the whole, getting rid of extra fat from any part of our body. Especially the waistline will get better. See how much the abdominal organs are moving. See? See? Hips are also moving. The one go, you are covering practically most of the part of your body. Give a good smile on your face. Love yourself. Very important. Well done. Now you can do clapping, which is a must. Do morning, evening, afternoon, clapping, clapping, clapping. Very good. Good for your heart and lungs, weight reduction, activation of the digestive system. Good for my joints, my ligaments, my bones. Plus, when you are singing, this is your dholak giving you a rhythm. Background music is coming. So you are your own musician playing your dholak. And other thing is you are doing your upchar, the treatment. activation most of the organs of the body by clapping. Come on, go on clapping. Go on clapping. Go on clapping. Clapping and move your body also. Why not? If you're fit enough, move it. And when you're doing your bhajan clapping, do loud clapping and singing so that your neighbor who is talking, you can't hear her. Plus, it makes you connect with the Lord. What we want, get connected. Get the full bandwidth of that bhajan then. Carry on. जोर से हंसते हुए मुस्कुराते हुए. The activation of all the organs. That's why we do dance also. We are dancing now. We are activating at our soul. All the organs are on the soul also. Here soul is S-O-L-E. But our soul, S-O-U-L, will be connected with the superpower. Loud singing is also pranayama, giving so much urja also. Increase your immunity. Clear up your throat. Activation of most of the chakras when we are doing this loud singing, bhajan. The chakras get activated. That's why sometimes the people go into the trance, they get connected with the supreme power. उनकी आंखें बंद होती हैं और मस्त हो जाते हैं. They don't know what is happening around them. They are just with the Lord. Well done, my friends. How active are you now? Or you want some more? Quite active? You can nod your head. You can do so many poses, simple poses. Now arms are coming up. Stretch your arm. Breathe in. Go on breathing in. Then take it down. Breathe out. Other one going up. Stretch. Stretch. You can look up also if there is no neck problem. Then breathe out. You can do both together. Stretch, look up. Tighten up your abdominal muscles to tone them up. Good for the constipation. And bring them down. Then other side, stretch out at the shoulder. And then up, breathing in. Then you can do your bending, twisting, going the left side. Either you can touch your chair or the ground. Stay there for a short time. Feel the effect. कमर पतली हो जाएगी. चाहिए ना कमर पतली. Summer is coming. We are going to wear blouses, sari and blouse, maybe sleeveless even. Hold it. Hold it. Then come up. Want more stretching, structural balance. Cow's pose. Cow's pose. Gau Mata ki jai. Gau Mata ki jai. You can do Kapalbhati, but don't start yet. I have to tell the precautions first. Hypertensive heart problems, severe acidity, severe asthma, do it slowly. If you're bleeding from anywhere, don't do it. Severe headache, moderate headache, don't do it. Glaucoma, don't do it. If you're any major surgery, 4 to 6 months, please don't do it. Even after minor surgery, you have to consult your physician or the yoga teacher, which one to do, when to start, how long to do it. This is very, very important. If you're having vertigo, dizziness, don't do it. especially people suffering from epilepsy or other seizure type fainting attacks, please don't do it. You can do your Kapalbhati now. Full attention is on exhaling. Kapalbhati. Multiple benefits. Multiple. Starting from the face, as the name is Kapal, means forehead, and glow is Bharti. If we do for 10 minutes, our face will change into glowness, as if you have put some cosmetics there. Then coming to your neck, the thyroid gland, parathyroid gland, vocal cords, they will get activated. Now, while doing Kapalbhati, it is affecting your whole face, your eyes, your ear, your nose, your mouth. Here come your sinuses now on your face. Very good for sinusitis. Other side, cow's pose. And we are supposed to do every pose maybe for now 1 to 2 minutes. And if we are suffering from serious ailments, then we might have to do 10 to 20 minutes, one pose. That's how we get better. You do slow, medium. Some demonstration about fast now. If we do fast for a long time, you won't be able to do for too long. Plus, you might get backache. It is only for people who have done a lot of practice. Doing yoga practice for 2.5 hours continuously, they can achieve this. Well done. We'll cover these poses later on also. Okay, our topic is sinusitis. What is this? Is sinus. Sinus here today topic is paranasal sinuses. The sinuses are open spaces behind our bones. When we are talking about their sinuses, can be anywhere else also, you know. Here today's topic is these face sinuses. We call it paranasal sinuses. That is just open spaces behind our bones on our face. So look, this is our chin bone. There's open space behind that chin bone. And then the eyes is there, open spaces. Then on the nose. And the other one is on this area, frontal. So there are 4 types there: frontal, maxillary, ethmoid, and sphenoid. This is your sphenoid. The level is the level of your nose, behind your nose, at the level of your base of your brain. They are open spaces. When they get inflamed, name is sinus, sinusitis. Inflammation is also itis, itis, like bronchitis, arthritis. Other arthritis also itis. Itis means inflammation. When they get inflamed, we get a lot of problems. And this happens after you have had cold or flu. And you must have heard a lot of this while the COVID-19 is still going on, I know, COVID-19. So usually this is affected by bacteria, virus. So this is blockage occur when you get the sinusitis. Look at the area, frontal sinus. So if this gets inflamed, I will get headache, lot of headache. When this gets inflamed, eyesight, will be affected. You will getting a lot of pain on your eyes area. Then the nose will be blocked because there's so much, the fluid which is supposed to come, and they are all connected to our nose and the nasal duct, and that's why we throw it out from our nostril. Now there is a blockage there because the mucus of that area is inflamed, it is got enlarged, so we can't throw out our mucus from our nose. And then this is our maxillary on the area of cheekbones. They are big ones. This is big and this is big. Other one, this is very small, and this nasal one is also on the nose. So these four are the one which is get inflamed, and we get all these symptoms. Symptom can be minor symptoms or severe symptoms or very serious symptoms. Usually we say a lot of pain in that area. Headache, eye pain, nose is blocked, cheek pain. So pain will become, and when it is very severe, you can get a lot of tenderness. When you touch it, you are getting a lot of pain there. And they get nose is blocked, and even you can't smell your food even because this is all blocked. And then you can get high temperature also with this, bad breath also, even you can get your toothache also. So sometimes the toothache is because of the maxillary sinusitis, which is affected. So this is very important symptom. I don't know what Maria has suffered. She will come back later on. So this is what is sinusitis. Open spaces which get inflamed. They are all behind your face bone. And sometimes the people get minor symptoms, sometimes they get very severe symptoms. And then how to treat this? That is very important. You should try to rest, plenty of rest. And then plenty of fluids you should take to drain out that. And here I can say, as we are in this country, Ayurvedic medicines are not much available. You can take simpler painkillers like paracetamol or ibuprofen, depending upon what your conditions are. Always check with your doctor because these things are available on the counter also. So don't go on buying without consulting your physician. And other thing is sometimes this is triggered by allergic factors, hay fever, we sneeze a lot. That is also the trigger factor. So look after that. And other thing is how to now get rid of this. Getting rid of this infection. The problem is here in the nose. It is not coming out. So our Ayurvedic Aushadhi are there, and plus you can do Jal Neti. And I am sure you must have watched Mr. Sarwar many times. He has explained already Jal Neti. Okay, that is a proper technique. Follow the proper technique. Jal Neti, clearing up. And if you don't want to do that, you take slightly warm water, put little bit salt, but don't put salt if you're hypertensive. Okay? These are the precautions, You can rinse your nose yourself. Like this, put the water there and then throw it out by blowing your nose. I think people, if they want Jal Neti demonstration, we can arrange next week, not today. Okay? But there are sort of precautions also you will look after. Make sure you throw out all your water which you have taken by Jal Neti. Otherwise, there will be another infection coming up. So that's why proper technique, how to do it, how to tilt your head, how to put it in, and then you do Kapalbhati, and then you go on patting your head so that everything comes out. Till the whole water is out, please make sure. Okay, and this is very helpful actually. Then here you can do, you can rub some web riper. That Vicks also you can rub on your chest, or you can just inhale those. That will also help you. And then looking to other things which we can do, home therapies, the black pepper, mishri, and sont, they help you a lot. So if people who are getting a lot of nose blocked and throat problem, they can always suck maybe 2 or 3 full black pepper and so sont if they have, If they haven't got a sound, that is your dry ginger. Then they can take fresh ginger. They can make a liquid of that, ginger, haldi. That will also help you. They are all increasing our immunities. And other thing is take vitamin C. Make sure what food you are eating. There are enough vitamin C and vitamin D because we want to increase our immunity. So these things are very, very important. Other thing you can do, if you are suffering with this problem, you can put badam rogam, the almond oil in your nostril. In the morning, do it empty stomach. Put 2 or 4 drops in your nostril, both the nostril, and just try to relax. And in the evening, before going to bed, you can do the same thing. So that will help you quite a lot. Other thing simple is, as when the COVID was quite active here, what we were saying, steaming yourself, steam yourself. You are doing inhalation of steam. Go on having steam. People have seen, the people who are working in hospitals, they were doing, when they come to the hospital, they start doing that. And they have found they didn't suffer much from COVID from the patient even. Inhalation is very, very important. Steam inhalation. You can do that. Very easy. Kettle is there. Boil the water and just put your head down and have those fumes coming up. Steam is coming up. And if you can't do that, you are too busy or too lazy, then you can do steaming in your shower. Put hot water. Don't burn yourself. That steam comes automatically. If we take a long shower, you can see in your bathroom, there's so much steam is there. So try to sit there in your bathroom for a long time and you will get a lot of steam. So this will open up our nasal passages very easily. Other thing, they said you can have salt and black pepper and pipli. I don't know what is that myself even, because there's so much Ayurveda is going on here. So this is what about it is, sinusitis, lot of problem. And if it is very severe, if you don't get better within 4 weeks, 6 weeks, please try to consult your doctor. He might have to send you to the ear and nose specialist, ENT. So don't ignore yourself. Now you can see this picture quite clearly, what area I have explained to you. Yes? You can see at the top is your frontal sinusitis. Near the eyes is your ethmoid sinusitis, doesn't matter name. Then the maxillary is on your cheekbones. And the redness around your ear in longitudinal way is your nasal one. Sphenoidal. So there are 4 main sinuses on your face. They get annoyed, they get inflamed and give us so much problem. Okay. Now here we are going to change now. What should we do? Our practice, which we do every day. So
Dr.
you have to
Kapur,
concentrate.
Dr. Kapur,
More.
I
Yes.
just want to let you know that I've got polyps in my nostrils.
Now who are you?
I'm Meena.
Just hold on. Let me see.
Meena.
You are Meena.
Yeah, I had asked you, and I've got polyps because I went to see ENT, and they said I've got polyps in both my nostrils.
That is different topic. Polyps is different.
Is it different to
Of
sinusitis?
course, polyp is when a little bit mass is produced, like lumps on your skin, fatty lump. Same thing, your mucosa of the nose has got overgrown, and they form a small, big area. Polyp can be anywhere, in your nose, in your intestine, and it can be in your uterus. Polyps can be anywhere, So polyp here is different. Your is a polyp which has to be done by the ENT surgeon. You can't get rid of, depending upon how big is your polyp, how much obstruction you are getting in your nose. If they are quite big size, they have to remove it. No problem. Very simple surgery. So this is nothing to do with the sinusitis. Sinusitis is inflammation. Here the tissue is overgrowing. Follow my point?
Yeah. I mean,
Simple
there's
example is
many
lumps,
steroid-
like lumps you get anywhere. We are
yeah.
getting so much fatty lumps here, there. But here the mucosa of your nose is overgrowing, forming a small mass, depending upon how big it is. If it is very little, maybe doing all these pranayama techniques, you can get better. But you have to do for a long time, maybe 2 hours, 3 hours, every step you are doing it. But if it is a big one, that has to be done by surgery. There's no other way. And it is very simple operation. Is that clear?
Yeah, thank
It's
you.
nothing to do with sinusitis.
Okay, because I thought this would help reduce the
Of
polyp.
course, it will help you. What I've told you, inhalation, steam inhalation will help you. And I'm going to Jal Neti, I will be careful. Okay? Because if you leave some water there, if you don't throw out all the water from your nose, the water which will be in your nose can give you more infection. It can easily get infected. Wetness. That's why, what we do, our utensils, we wipe them dry so that there's no bacteria going to grow on that. Same thing in the nose. If you leave water there, it will get infected very easily. Dry, completely dry. Nose should be completely dry when you're doing gel knitting. Same thing if you are doing rinsing out process, as I explained, rinse out. Again, make sure you don't leave any water there. Now, how big are your polyps?
Not very big, but he said that if you can live with it, then don't have it done now.
Then best thing for you is, as I told you, leave it. Follow all the steps I have told today. They will help you.
I will.
Follow all the steps I said, whatever is available, Ayurveda or like almond oil told, and the steam inhalation, then black pepper and your mishri, sont, they will all help you. There won't be any harm by doing this. So please do it religiously and get better. And now we are going to touch our pranayam. Which one to do, how long to do it. But again, if you have got this problem, you are supposed to do for a longer time than the other people who haven't got any polyps in their nose.
Yes.
This is a thing. One is preventive medicine, not to get problem. Other one is giving treatment, therapeutic. So in your case, you need therapeutic. That means you have to do everything for a long time.
Okay.
Okay?
Yeah, thank you.
Okay, where is Maria? Now she can come, I think, as we have
No.
stopped in between. You want to come, Maria? What problem you have? You asked this topic specially. I don't know. Where is she? Okay, let's move on.
Dr. Kapur, it's Meena Haria.
The Maria,
Nini.
Mina.
You Meena,
Yeah, not
but,
Maria.
you are the one. You asked for
Yeah.
sinusitis.
yes.
But you had polyps.
No, I only found out
Well
yesterday.
done. At least we have covered your polyp also. Well
No,
done, Meena. Well done.
I
Okay,
went
let's move
to-
over now.
Yeah.
So you're happy? You got your answer? Or
Ye-
still some doubt?
No, I went to ENT yesterday and I found out.
Yeah. Tell us what they
polyp.
told you.
Yeah. So I thought it was sinusitis because that's what was identified before.
Okay.
Thank you.
They have told you you don't have to have operation yet. Wait.
Yes, he
Yeah,
said.
so carry on.
Yeah,
So please carry on what we have told you.
Right.
I will.
This will benefit you.
Thank
Next,
you.
going to the pranayam steps.
Yeah.
Now here we want to increase the oxygen level of the body throughout. So first one is our Bhadrika pranayam. Here you are supposed to do for longer time, people suffering from sinusitis. Otherwise, as a preventive method, you do for 3 to 5 minutes. But with the sinusitis, you're supposed to do 10 to 15 minutes, morning, evening, religiously, with full attention. So Hands are in Dhyan Mudra. Go on breathing from the nostril. Keep your neck straight, spine straight, shoulder behind. So everybody has seen the sinusitis, right? Yes. So I'm going to remove that now. Carry on with your Bhadraka Pranayam, please. Doesn't want to go back. Carry on. Go on breathing from the nostril at your own pace, slow, medium. And go on chanting inside. The prayer you do at home, any shlok, any mantra, any shabad, any dhun, and concentrate on the problem. Today problem is sinusitis and the polyps, nasal polyps also. Concentrate on that. This is all your diaphragmatic breathing. When we breathe in, our chest expands so that our lungs function properly. There is good exchange of gases at the alveoli, and they are multiple, in millions, where the gas is exchanging. Concentrate on your lungs. Lungs are expanding, doing their work. Diaphragm is going down. That's why the abdominal muscles are coming out, showing, bulging out. When we exhale, diaphragm is coming up, stomach is going in, and the chest is getting smaller. So always make sure. You can put one hand on your chest, one on your tummy, and feel that. Long breath in. Then exhale. Breathe in. 2.5 seconds, 5 seconds, 7 seconds even. Then breathe out. So this is what Bhadraka is doing. Increasing the circulation in every part of the body. Oxygen is getting more. So getting rid of most of the problems. Whole systems are getting better. The central nervous system, the brain is getting active. Getting more concentration, memory, and get rid of this paralysis and various other problems of the central nervous system. Multiple sclerosis, MND, that is motor neuron diseases, and dementia, depression, agitation, anger, chinta, Kam, Krodh, Lo, Moh, Hankar, and Mat. They are all disappearing. No worries at all. Then coming to your heart and lungs, getting the benefit of that increased level of oxygen. The cells which are dying, they will be rejuvenated. They will grow up. That is being demonstrated many times by our Swamiji, Ramdev Ji Maharaj. Pranam, pranam, pranam. That degeneration is converting into regeneration. हम बुढ़े नहीं हो रहे, हम जवान हो रहे हैं ये steps करने से. Your respiratory system, cardiovascular system, digestive system, excretory system, and the reproductive system. They're all getting activated by increasing the oxygen level. So try to do this Padrika for a long time. Next is Kapal Bhati. Here the mudra is Vayu Mudra. This mudra is also going to help me for my sinusitis also. This mudra, Vayu. Problem is of the Vayu. Vata problem is there, that's why this is helping more. Can be cough also, as we know, cough. So this is going to help us to get rid of Vata problem. Again, itis anywhere, arthritis, bronchitis, whatever itis is getting better with this. And increasing the digestive system power because of increasing that Agni in the stomach known as Jathar Agni, which is digest our food. Okay. So do Kapal Bhati. 1 stroke, 1 second, full attention is on exhaling. Slow or fast, or slow or medium, no fast. Just for demonstration. You have a good smile on your face. I want to get better with my sinusitis. I can't smell my food. No smell there. My nose is blocked. I'm getting pain on my face, on my eyes, my cheeks, my forehead. I want to get rid of that. Concentrate on the problem. My pulse is going to get smaller. And any other lumps in the body, anywhere, whether they are fatty lumps or they are like benign lumps or even cancer. But again, one have to do for a long time and take lot of Ayurvedic medicines also. So much is added up. Then they talk about Havan, yag treatment. That is very effective. Next, you change to your Pran Mudra. This is also very good for the problem what we are talking today. Increasing immunity flow of your prana here up and down going, and plus good for your eyesight. Pran Mudra. Today I will only touch the mudras which are going to affect my sinusitis. Do it for a long time. Pran Mudra. Make sure the whole stomach is moving. The upper part, middle, and the lower. Get rid of diabetes, the fatty liver, hepatitis, cirrhosis of liver, even liver cancer. Then the spleen on the left side of your abdomen, upper part, spleen, blood formation. Then the whole intestine, the stomach, the duodenum, large intestine, the colitis. If you're suffering from hyperacidity, do it very slowly. Kapal Bhat. Same go with severe backache, do very slowly. Close your eyes, focus on the problem. Today is sinusitis problem. Take your mind to the sinuses, 4 sinuses I showed you. They're known as paranasal sinuses. Go on chanting inside. Om Namo Bhagavate Vasudevaya. Om Namo Bhagavate Vasudevaya. Om Namo Bhagavate Vasudevaya. Carry on. If you're feeling tired, you can rest in between, then restart with mantra japa. Om Namo Shivaya. 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 The next mudra is your Ling mudra. This increases the heat in the body. Good for the sinusitis and various other problems. Your vocal cords, your thyroid gland, parathyroid gland. And increase your blood pressure. People suffering from hypertension, low blood pressure. Full attention on your sinuses, on your face, your polyp, nasal polyp also. Lift up your spine. Very good. The next mudra is your Shankh mudra. This is also very good for the sinus problem, for the thyroid gland, parathyroid gland, plus various other benefits. Then other hand, Shankh. Carry on. Okay, the next one is new mudra actually. Bauchari mudra. Very simple. Bring your these first three fingers, index, middle and the ring finger at the toward down inward, and take the thumb like this outward. Yes, thumb is outward, index, middle, ring finger inward. Then put your lips onto the nail of the thumb and try to look at your little finger without blinking your eyes. To concentrate, actually, you have to do one hand. Just look at the tip of the little finger, thumbnail is at your lips. Got it? First three fingers bent, thumb is outside, little finger is also wide out, lips touching the nail of the thumb and concentrating on the tip of little finger without blinking. Then close your eyes and relax. This will take away any type of headache, migraine headache, take a lot of stress from the body, plus for the sinusitis. Well done. Now we can do a Chakki Asana. Stretch your arms. Clockwise, anti-clockwise. And go on breathing. Or with the practice, we can do even Kapalbhati with Chakki Asana. Nowadays, Swamiji is showing us with every asana we are doing Kapalbhati. And next week, I will add on one more thing. What extra we are doing? You can do Bhadrika, Kapalbhati while doing these physical exercises. Next is your churning. We want to make charge. Move your legs also. Churning. You are very strong for that. Everyone is doing so well. Charge पीते हो ना रोज. धनिया डालिए उसमें. जीरा काला करके उसको भून कर उसका पाउडर बनाकर. Especially the people who are suffering from colitis. और इसका वो एनिमा देखते हैं वहां पर पतंजलि में. एनिमा भी छाछ का. और छाछ भी खूब पिलाते हैं वो. कुछ और देखते ही नहीं खाने को, छाछ पी लो, बस डिटॉक्सिफाई कर लो अपने आप को। उपवास, फास्टिंग, वेरी स्ट्रॉन्ग नाउ। इंटीग्रेटेड योगा में सब कुछ आ गया। वेरी गुड, गिव अ गुड स्माइल। मैं पतली होने जा रही हूँ। अगर मैं पतली हूं तो मैं थोड़ा और वेट पुट कर लूंगी। शाबाश, सुरेश की स्माइल दे दियो। Well done. Spread your legs now and touch with the opposite hand. Come on. ये कितनी बार करना है? 10 बार, 20 बार? Really पतला होना है. Get rid of this obesity. 100 times, 1000 times. लगे रहो मुन्ना भाई. Come on. गर्दन को भी हिलाएंगे साथ में. जितना ज्यादा ओवरवेट उतना ज्यादा काम करना पड़ेगा. Carry on at your own pace, slow, medium. कई फास्ट भी कर रहे हैं. मैं आज नहीं करूंगी, मैंने कल बहुत किया था. Carry on. तुम करो प्रभु से प्यार, अमृत बरसेगा. तुम करो प्रभु से प्यार, अमृत बरसेगा. बरसेगा भाई बरसेगा, बरसेगा भाई बरसेगा. तुम करो प्रभु से प्यार, अमृत बरसेगा. ओम नाम का अमृत प्याला, ओम नाम का अमृत प्याला, पीले बनकर किस्मत वाला. ये मिले न बारंबार, अमृत बरसेगा. तुम करो प्रभु से प्यार, अमृत बरसेगा. दया धर्म से प्रीति कर लो, दया धर्म से प्रीति कर लो. भव सागर से पार उतर लो, भव सागर से पार उतर लो. तेरा हो जाए बेड़ा पार, अमृत बरसेगा. तुम करो प्रभु से प्यार, अमृत बरसेगा. तुम करो योग अभ्यास, जीवन सुधरेगा. तुम करो योग अभ्यास, जीवन सुधरेगा. सुधरेगा भाई सुधरेगा, सुधरेगा भाई सुधरेगा. तुम करो योग अभ्यास, जीवन सुधरेगा. ओ काफी कर लिया. बाकी घर पे जाके कर लेना अपने कमरे में, ठीक है.
200 टाइम्स किया.
कितनी बार किया आपने?
किया, मैंने काउंट किया 200 टाइम्स.
हैं? ओ तालियां
Yes.
तालियां. Well done. That's what we want to do. Increase. Get the benefit. ठीक है ना? चलिए आप करेंगे मुंडू का आसन. Everybody knows. Breathe in, breathe out fully. Activate your sinuses. Go down, look at the ground and lift the head up, straight looking. Kapalbhati. Then breathe in and come out. Left hand at the navel, right at the top. Breathe in, breathe out fully. Then go down. You can squeeze your stomach much better in this position. Then breathe in and come up. Now you want to concentrate more on your liver and spleen. मुट्ठियां जाएंगी इस level पे. And if you are overweight, you can't bend down and do it. No, it won't go in. So sit straight and do it. And if you are too thin, you won't be able to do it because these bones are pinching you badly. Carry on. Kapalbhati. At your own pace. Smile on your face. Concentrate on the problem. Today's problem is sinusitis. The nasal polyp, so add it up. Well done. Already we have done the cow's pose. We have done already. We do Shashakasan, Khargoshasan. Breathe in, stretch, look at the ceiling, then come down. You can touch the ground, especially if you're on the mat. Your forehead is on the ground. Then you breathe in and come up. Stretch again, look at the ceiling, and look straight and bring the arms by the side. Next is your Vakarasana. The right leg is on the left, or you can bend your right knee and stretch out the left leg. And we are going to look right side and do Kapalbhati. Relax, other side. Looking towards the left, as far behind I can go. Then relax, look straight. Fifth one is your Yog Mudra Asana. Yog Mudra Asana. Left hand at the navel, right at the top. Breathe in, breathe out fully. And we are looking at the ground now. This is best done on the mat in Padmasana, the lotus position. And your chin is touching the ground if your body is so flexible. We do on the chair is more than enough for us. You can do Kapalbhati if your body allows you. These are the best poses for any abdominal problems. Activation of pancreas, the liver, the gallbladder, spleen, intestine, even the reproductive system also, kidney problem, excretory system. But again, if you're suffering from diabetes, if there is not enough time, try to do Mundukasana, Pavan Muktasana, and this Yoga Mudra Asana. And go on repeating for 10 to 20 minutes. That's more than enough for diabetes. That's what I said. You concentrate on the asana, on the pranayam, on the physical exercise, depending upon your problem. Obesity, abdominal problems. Then memory problems. Here my memory is going to increase with my Yoga Mudra Asana, because I am giving more oxygen to my brain. I won't suffer from dementia, depression, agitation. Plus good for my hair loss also. And breathe in and come up. The variation of this one you can do like this. Hold your hand in the back. Breathe in, breathe out fully and go down. And stretch your arms up. Variation of Yoga Mudra Asana. You are getting a lot of pressure from your thighs up to your abdominal organs. You can't do Kapalbhati with this. No, I can't do it. Then you breathe in and release. Yoga Mudra Asana, 2 poses we have done. Now next thing is, every day we are doing. For every problem, the protocol is just the same. Just the same. So easy. Anybody can do. Anybody can do. In any condition. The next one is acupressure points for the sinuses. We all know our sinuses are here. Just below our upper part of the finger and the thumb. They're all here. Here, 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 and on the thumb. So what to do? Press, make this mudra. And you are doing your acupressure. Yes? You have to do a little bit, giving extra pressure on that area, sinus area. Do this for a long time. Watching television, listening to nice katha going on, bhajan going on. You can do this, press hard. Acupressure of the sinuses to get rid of my sinusitis. Can't do like this. I'm very fragile. So what should I do? Do like this then. Pressing upper part. Go on pressing every finger and the thumb, and you are singing your bhajan or listening to nice bhajan, any mantra. Close your eyes. Dhyan Purvak Yog. Full Yog. Purnamida Purnamidam Purnyat Purmuchyate Purnasya Purmadai Purmeva Vishishyate. All Puram. Then the effect will come on the body. With good faith and surrender. Puran Sharnagati. मैं तेरा तू मेरा, मैं आपका हूं, मुझे ठीक करिए. All the fingers. And if you can't do even that, then somebody should help you to do this for you. If that condition comes, most of the people are having carers. So tell your carer to do that. If nobody else is in the house, tell them, and get the benefit. Then you do Anjali Mudras, Namaste Mudra. Press it hard, press it hard, press it hard at the heart level, giving respect to each other. Namaste, namaste, namaste. During COVID time, everybody has learned about Namaste. Jai Mata Di. Namaste. Because no shake hand anymore. So many germs are there on our hand and we are spreading. Even now people are very conscious. Namaste ji. Haath nahi milana. Namaste. To protect ourselves and we respect each other. Namaskar. Now going back to the rest of the pranayama steps. The next one is spend more time on Alom Vilom. Alom Vilom. So let's start that. Vayu Mudra. Throw your right nostril with the right thumb. Everybody knows. Make sure the hands are moving, not staying in front of your nose. Otherwise, carbon dioxide will go back. Long deep breath from the left nostril. Very little sound is produced with this. Again, 2.5 seconds or 5 seconds or 7 seconds, depending upon your practice. Long deep breath in, slowly. Then close the left nostril with these two fingers, the tip of your middle and the ring finger. Gentle pressure on the left nostril and exhale from the right. Here the time should be equal. Inhalation, exhalation. And with the practice, the exhalation should be longer than that, get extra benefit to get rid of all the toxins, carbon dioxide from the body. We have thrown out from the right nostril. Now we'll breathe from the right nostril. Then again, hand is going up and exhaling from the left. One cycle of Alom Vilom. Alom means Ulta and Sida, which is going to activate our brain, both the hemispheres, balancing them. And here sinuses are going to open up. That's what we are going to do for a long time. So many other benefits. We are going to open up all our channels, all the nadiya, they will open up so that there's a good flow of oxygen up and down sideways, all over whole body. Get rid of sinusitis, bronchitis, asthma, headache, increase vision, even the hearing, because oxygen is going to go in the ear also. Then not to get kidney problems, nephropathy, then the peripheral nerves. There is no sensation left, hot and cold, or feeling as if the ants are going on pins and needles. Production of good hormones. Going to control my lipid profile. Kidney function. Everything is getting better. Whatever you want. Dementia, depression, paralysis, motor neuron disease, Parkinson, whatever you are suffering. Whole system is covered. Sinuses will open up, but have to do for a long time. Morning, evening, all the day. Swami says, do Anulom Vilom whole day. Whole day. Well done. Next is Bhamni Pranayam. Very effective pranayam. मन को एकदम शांत कर देता है. Good for hypertension, heart problem, anxiety, de-stressing pranayam. Insomnia, नींद नहीं आती. Menopausal problems. सबके लिए बहुत अच्छा है. And as we are breathing in and out, of course, it will help us our sinusitis also. We do 3 times. Udgit Pranayam, again going to help us for various problems. Cooling our mind completely. We are going towards the stage of Samadhi. Bhamri, Udgit and Pranam is the one we are antarmukhi. To want to achieve our goal of Samadhi. Slowly and slowly. Oh. 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 Activation of so many chakras by doing this. Udgit Pranayam. Manipur Chakra, Anhat Chakra, Vishuddhi Chakra, Agya Chakra, and then Saskar Chakra. They're all getting activated. Simple. Next is silent meditation, pranav. Fix your mind either on your breath or the Agya Chakra. Go on chanting inside Lord's name, whatever you practice, any mantra, any shabad, any dhun. Go on chanting inside. मौन की अवस्था में अंदर अंदर मेडिटेशन चल रही है, जपा जाप चल रहा है अंदर ही अंदर. Say inside, I am never alone. I am never alone. The supreme power is always with me. He shows me the path, how to serve humanity. Give us the strength to do our yoga practice. मैं अकेला नहीं, वो सर्वशक्तिमान सदैव मेरे साथ है. उन्हीं की अपार कृपा से ये सब कुछ हो रहा है. Whatever is happening with His mercy. मैं अकेला नहीं. धन्यवाद, धन्यवाद, धन्यवाद. Lay your arms up, rub your palms. Put the palm on your eyes. Slowly open your eyes and remove the hand. Next is Singhasan, which is also very good for the sinusitis today topic. Plus, it's going to help my eyes, my ears, my thyroid gland, parathyroid gland, and warm me up. Good for my voice also. Ah! Ah! Twice is enough for me. Then come your laughter. Go on laughing. Sinuses will open up themselves. Come on. Ah, 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 ah,
Dr. Kapur ji,
Very nice.
very
Thank
nice.
you.
Sarve bhavantu sukhina, sarve santu niramaya, sarve bhadrani pasyantu, ma kashchitu dukha bhag bhave. Om Purnamida Purnamidam Purnyat Purmuchyate Purnasya Purmadaya Purnmevavashishyate. Hari Om Tat Sat. Hari Om